So, hexavalent chromium. This is assessment of the risks, hazards, and safe handling of this product. We'll learn in this module here. Hexavalent chromium is one of the valent states of the element chromium. It is usually produced in an industrial process. It is known to cause cancer. It also targets the respiratory system, kidneys, and skin and eyes, as well as the liver. It is added to alloy steel to increase hardiness and reduce corrosion of different types of metals. It may be used in pigments, dyes, paints, inks, plastics, and is also an anti-corrosion agent added to paints, primers, and other surface coatings. The people that would be at risk of exposure were people in the field of welding, other types of hot work on stainless steel and other metals that contain chromium, use of pigments in sprays, dyes, coatings, operating chrome plate baths, and the use of the strong adhesion product of Portland cement, which is a powder-based product that once you add water to it, it creates a very industrial, hardy adhesive. Some of the known health effects of this product would be occupational asthma, respiratory irritation, respiratory cancer, eye irritation and damage, perforated eardrum, kidney and liver damage, pulmonary congestion and edema, upper abdominal pain, nose irritation and damage, skin irritation and erosion and discoloration of the teeth. May also cause allergic dermatitis, a long-lasting, more prevalent with repeated exposure, and contact with non-intact skin could lead to ulceration of the skin. These ulcers would be crusted, painless lesions showing a pitted ulcer covered with fluid. It's a known carcinogen that can cause cancer in the lungs, navel, and sinus passageways. How exposure happens. Inhalation of dusts, mists, and or fumes of hexavalent chromium containing substances, as well as contact with the skin and eyes. Some risk management that you could use to prevent exposure or reduce exposure of the product would be engineering and safe work controls to keep exposure below the permissible exposure limit, use of regulated areas with limited access, warn employees of the risks associated within these regulated areas, use of respiratory protection, use of personal protective equipment, and proper housekeeping. The types of controls that we were discussing previously would be engineering, such as using less toxic material or a process that would result in a lower exposure, isolation, such as enclosing the source of exposure, and ventilation using a local exhaust system that would capture the airborne chromium and expel it from the area. Some safe work practices would be adjusting the way a task is performed so that you reduce your chance of exposure. Workers must know how to perform a task in order to minimize their exposure and maximize the effectiveness of a control. For example, if you were doing some welding, you'd make sure that you're standing and welding in a manner that you'd optimize the use of the hood vent and eliminate that product from the air around you. The use of regulated areas from the rest of the workplace in the manner that adequately establishes and alerts workers to the boundaries of the regulated area. This would be done by use of warning signs, gates, ropes, barricades, lines, textured flooring, or any other method that would be appropriate and would do the job. Must effectively warn employees not to enter these areas unless they are authorized. As well, all persons who enter the regulated area must use proper protective equipment, including respirators when necessary. Some examples of what would be considered the appropriate personal protective equipment would be respirators when you have an airborne form of it, gloves, aprons, coveralls, foot coverings, and goggles would all be mandatory as well. Lastly would be the proper use of housekeeping to ensure that you're not accumulating more of the product to increase the chance of exposure. Cleaning up spills and releases of hexavalent chromium material promptly to reduce the chance of somebody else coming in contact with these, as well as use of a housekeeping schedule, a maintenance schedule, to ensure that areas that contain the product would be continually cleaned and not have a buildup on a day-to-day basis. And the use of safe cleaning methods. For example, using a HEPA rated vacuum cleaner to clean up piles of dust and such, wet scrubbing and mopping so that you're dampening the product to reduce the chance of it becoming airborne and becoming exposed to it. So basically that's it in a nutshell of things you can do and keep yourself safe when you're using this product. I appreciate your time.